Hello everyone, I am Berk-Karatas. Do devices that stretch the penis, namely penile, extender devices, actually make the penis longer when used? Is this a fact or just a rumor? I will talk about this. So why did I prepare this video? Of course, I know the answer to that because I have been living this firsthand for years, but of course it's not enough for just me to know. A little bit too, there are a number of rumors about this. More precisely, what patients have been telling me has been said for years, but it has really increased a lot recently. Unfortunately, some of our doctor friends say that the penis only grows by cutting the ligaments. It cannot grow in any other way. This is completely, I don't want to say things like it's not the right way and so on. I used to give long answers when he said things like that, but now I see that it was done on purpose. I say that I'm no longer responsible for the ignorance of my colleagues, and I am closing the subject. In the end, there are those who want to seek treatment, and there are those who don't. We don't have a situation where we can force anyone to get treated or to enlarge their penis. Now, we have two main studies related to this. Both of these are meta-analyses, meaning they have analyzed studies conducted over the years. They have reached an average conclusion. These two studies are very important. They have reached an average conclusion. These two studies are very important. One of them includes the studies conducted with the penis extender device up until 2008. It includes the studies from after 2008 up until 2021. These are two quite nice studies that I will share. Now, using the extender device, the penis length increases between 1 to 3 centimeters. In terms of length, it increases between 1 to 3 centimeters. It varies from person to person. I didn't take the pros and cons here. I got one to be able to explain this. For example, the average penis, it's elongated here. This is 0.5 to centimeters. So, of course, in some patients, when the connective tissue is not very stretched, especially in older patients or those with other health problems, it can drop. But we can achieve an increase in size between average cm. So an increase in size can be achieved. Look, one of the biggest questions being asked is, okay, what about the position of the penis? But does this also happen with hardness? Yes, it does. It does happen with hardness. Here, of course, since these studies were done only with the extender, meaning no other methods were applied, there is a 1-2 millimeter decrease in the hardness of the erect penis. Statistically, it's not very significant, but when you add vacuum, shockwave, and PRP to the extender device, it clearly increases the penis capacity. Plus, these factors increase a bit more. There are also studies related to this. Plus, these increase a bit more. There are also studies related to this. I didn't bring these up because it's not our topic. I had explained this before. So, in the end, the extender is a device that helps the penis grow. Now, in these studies, I directly translated those things from English to Turkish. I didn't make any interventions, and I just placed it here. The summary of the results of both studies states the following. Once a person has decided to lengthen their penis, the first treatment you would recommend is non-surgical extender lengthening treatment. It says that the first treatment you would recommend is non-surgical extender lengthening treatment. It says that it provides effective and permanent enlargement in both flaccid and erect states. Another situation is that all patients, meaning some patients may have a penis of normal size with no issues, might still want to enlarge it. There are also those who are small, meaning there are some who are below average. Without exception, since there are no side effects and no complications, it needs to be used under doctor supervision. So don't get the idea that you should just go out and buy an extender. I'm thinking of going to get an extender tomorrow. Here, the extenders used are special extenders. Therefore, when you use this regularly under doctor supervision, growth is achieved. And this is recommended for all patients. Now, the most interesting part is this. There's something that gets overlooked or something that isn't being said. When surgery is performed, that is the pes ligament, I'm doing it. In conclusion, Facebook, after the cut, I tell all my patients, look, we will cut your ligament, but you will use the extender device. Yes, you won't be using it for a long term, like 6 months to a year for enlargement surgery. But I say you will use it for at least 3 months. Look, in these studies, they say this with a common decision. It says that traction on the penis after surgery should always follow the surgery. It says our recommendation, so it says to do it. So this procedure can prevent shortening of the penis. It says it can also provide length addition. Therefore, the penis extender device is something that is already recommended after surgery, that is, after the ligament cut. So, those who say that the extender device doesn't lengthen the penis, or who hold this opinion, why are they using the extender after the ligament cut then? Or, isn't the extender used after the ligament cut? This is also a question mark, but you should be careful about this. In short, no matter what anyone says, it is recommended to use an extender device after a ligament cut. I personally make sure my patients use it after the surgery. Is there anything else I should mention? No. Thank you.